The CARE Act became law in May 2014, forging a new coherent approach to adult social care in England. Before this, English social care law had evolved piecemeal over almost 70 years in some 30 Acts of Parliament and various key reviews and reforms. The old system was confusing, hard to navigate for those who needed care and support, their carers, and even those managing the care system. Care and Support Minister Norman Lamb described it as not fit for purpose to respond to the future challenges faced by care and support. Part 1 of the Act and its statutory guidance consolidates and modernises the framework of care and support law. It sets out new rights for people needing care and support and puts carers in the picture, making it clear what kind of care people should expect. And it sets out new duties for local authorities and their partner organisations. Let's look closer at some of those new rights for people and carers. There will be a clearer and fairer system. A single national eligibility threshold, continuity of care if you move areas. New protection if a provider fails. A cap on care costs. Note how this will positively affect carers. It means that they should get help before they reach crisis point. Their needs will be given just as much weight as those they care for. And back to those new duties for local authorities. They will have a universal obligation towards all local people, not just those eligible for local authority funded care. They'll have a general obligation to prevent, delay or reduce the need for care and support for adults and carers in their area. They'll have to provide information and advice to help people understand the care system, access services and plan for the future. But it's not just local authorities who have these obligations. So do their partner organisations such as health services and housing providers. This is really important. Those awkward gaps between service provision should be filled by the Act. The idea here is to create a system which prevents and delays the need for care and support. Because as we all know, prevention's better than cure. So how will a person experience the new system? Assessment for all? Care and support plan? Personal budget? Direct payments? And when will all of this happen? Well, most of the changes will take effect from April 2015, although the care cap won't be introduced until after April 2016. The whole Act has well-being at its core, be it physical, mental or emotional well-being. This isn't just about red tape and procedural change. With well-being placed firmly at the centre of this new legislation, a renewed ethos of care is being cultivated for everyone.